At the base of all things rehab that I do is McKenzie method therapy. A lot of times, like the vast majority of times with the plantar fascia, people need to do repetitive dorsiflexion. It's getting that dorsiflexion because one, it actually accomplishes a lot of things at once. I'm always talking about like, okay, I'll usually kind of call the plantar fascia issue a derangement at the ankle and kind of give an explanation about like how the ankle is not quite sitting right in space, and this is the direction that's going to recentrate that joint and offload the tendon, the muscle, the nerve, the joint, etc. So that way all your functional baselines come back up and your symptoms eventually improve over time. The reality is if you're doing a lot of repetitive dorsiflexion, you're stretching the calf and the soleus, you're getting a productive rehab stretch across the plantar fascia. No exercise ever exists in a vacuum and only works on one specific thing, but we
Mm-hmm.
don't have to apologize about an exercise treating multiple things at once, right?
Absolutely not.
So it's nice because then if we see that repetitive dorsiflexion is then bringing up the functional muscle strengths that we talked about in the assessment, and we're getting some of that active and passive range of motion back, then we got this thing on the run.
Mm-hmm.
Then I really like a lot of pin and stretch. That's something that I'm going to demo this month with a video, is how to pin and stretch across the bottom of the fascia for the plantar fascia. That's going to really help to not only obtain more of that dorsiflexion range of motion, but really get that thumb contact and drive and burrow into getting that productive stripping out of that tissue. And then a couple sets of adjustments are really nice. Like it's really good to just like reset the whole joint kinematic at the entire talocrural, like the ankle joint with the long axis. And again, just helping people generally drive a little bit more dorsiflexion. We have like a toggle board technique that we'll demo as well too. Those are just kind of some of the very good predictive things. And then I like a lot of the strengthening exercises you said. Eccentrics are great. After we get people's pain stabilized, some of the other exercises that I really like is actually teaching people how to do constructive arch raises, actually
Mm-hmm.
teaching them how they can do like a 5-step thing to raise their arch and then teach their brain how to lower the arch so they can get that command back over their body. One-legged balances with like hip circles or star patterns while they hold that arch is really good for rehabbing this.
Mm-hmm.
I don't know if you've ever done or have ever seen where you could actually like lay out a towel and have people do like toe
Oh,
scrunches,
I do it all the time.
and then push it back out like that. That is
Mm-hmm.
such a good way to just retrain the entire foot intrinsics, because the more you kind of balance out the foot intrinsics, the less the plantar fascia has to take on.